Good morning, good afternoon, and good evening to the colleagues connecting from the different regions of the world. And thank you very much for taking the time to attend this webinar that we call the Knowledge Dissemination Dialogue, where we feature different colleagues in different regions of the world and the work they are doing and presenting some of the data that they find in terms of finding solutions to control this issue of AMR. Today, we'll have the pleasure and the privilege of listening from Pilar Donado-Godoy, a colleague based in Colombia, with a very interesting profile and experience working with international organizations, working at international level, and working in Colombia with academia and with the industry and doing a lot of research. So it will be quite interesting to listen from her. Just a few housekeeping rules. Please keep your microphone on mute. If needed, in case the name that you have now on Zoom is not the proper one, rename yourself with your organization, your country, followed by your name. Please note that the views presented in these webinars are the one of the speakers, not necessarily the FAO. If you make an intervention or a comment in the chat, please refrain from advertising your services, your company, or any other commercial product or brand. And please post your questions in the chat. As I said, we aim to make this a dialogue where it's not a one-way direction dissemination, but a dialogue and interaction between colleagues. So we'll try to have as much time as possible for the discussion at the end, based on the questions that you post in the chat. And in case we don't have time to address them, then we can follow up after the webinar. Keep in mind that this meeting is being recorded, and the video registration, the PowerPoint, will be posted on the FAO YouTube channel and share with the participants, together with additional resources that Pilar was kind enough to share with us, and that will be available to all the participants. So I'll stop here and pass it to Pilar to make her presentation. Thank you.
Good morning. I'm going to share my screen. You can see it now? Yes?
Yes, it's great. Thank you.
Okay. So good morning, good afternoon, and good night for some people, everybody. I am quite pleased of this invitation to the webinar series of knowledge dissemination dialogues on antimicrobial resistance. I am pleased to be able to share with you my practical experience of conducting antimicrobial resistance research based on One Health approach in Colombia. I will outline the challenges I face, which I believe could be representative of common situations in low and middle income countries. So I will first present some specific risk factors that exist in Colombia for antimicrobial resistance development. I will then outline the general framework of the organizations on the fight against antimicrobial resistance in Colombia. Then I will present the specific research initiative we took in Agrosavia, the National Research Institute of Agriculture, and the next step we have initiated about the elaboration of a national research agenda. Finally, I will conclude with 4 remarks. Some specific risk factors that exist in Colombia. So the population of Colombia is 50 million people. It is a relative large territory, a little bit more than twice the size of France, with one of the largest biodiversity in the world. We have different thermic floors, from hot and humid one to paramos. The GDP per capita was slightly over $5,000 in 2020, which ranks behind Uruguay, Chile, Argentina, Brazil, Peru, and Ecuador in Latin America, with a Gini index over 54. That means that it's one of the most unequal countries in the world, as you can see in the map. The urban population is around 80%, and the capital, Bogota, has more than 10 million population. There are lots of population movement due to conflict with internal displaced population over 5 million people, and a recent migration, especially from Venezuela, of more than 2 million people. About the health system in Colombia, if we are looking at the average figures, the situation is relatively good, with a population coverage eligibility close to 95%, slightly below the average of OECD. Countries with financial protection of 78%, meaning expenditure covered by compulsory prepayment. But the satisfaction of the population with the health system is much lower, only 47%. In a recent survey, 83% of people think many people cannot afford good health care. And more than 60% of people believe that the healthcare system does not provide the same standard of care to everyone. Therefore, despite an average performance quite good for the region, there is a significant inequality in the system coverage. And in 2021, the population in need of health assistance was estimated to be more than 3 million. So we can say that the health system is under pressure to offer the same quality for all of the sectors of the population, which could result in an overuse of antibiotics. For example, the defined daily dose for carbapenems is 20 times higher than in Europe and North America. As far as the risk of AMR development in agri-food sector, one characteristic is that there is a significant part of the agri-food market which is informal, making the antibiotic stewardship very difficult to achieve. Just an example, on the average of milk production in Colombia, as you can see, 7.5 million liters of milk per day, of which only 3 million was collected and controlled officially, and the same level of informality can be seen in most agri-food markets. Therefore, the resistant profile that we can observe are broad and quite different than in high-income countries. Here, as an example, we can observe a resistant profile of Salmonella in the poultry sector that for the most common serovirus, paratyphi B and Heidelberg, are close to 100% for fluoroquinolones, beta-lactamics, and tetracyclines. And then another element I would like to emphasize is that in low and middle income countries, there are much more points of contact between humans and animals and environment than in high income countries for various reasons, including more population in rural areas, informal markets, deficiency of infrastructure like water treatment plant, etc. Here is an example in a quite populated area of Bogota, where we can find in a limited space a big slaughterhouse, close to a water treatment plant, close to open rivers, close to a big public hospital, close to one of the biggest central open markets. So we can find in Colombia numerous potential hotspots like this for the emergence of antimicrobial resistance. As a conclusion of this part, we can see that there are specific risk factors in low and middle income countries like Colombia that are quite different from risk factors that we have in high income countries. Now, what about the general framework of the organization for the fight against antimicrobial resistance in Colombia? The basis of the organization is the Global Action Plan, developed for WHO in 2015 with 5 objectives and different activities. In the research, we are concentrated on the objective 2, which is strengthened knowledge and evidence-based use for policy and practice decisions. In terms of activities, we can see that in the Global Action Plan, there is clear set of research activities in parallel with surveillance activities. And in objective 5, which is increase R&D on new medicines, diagnostics, vaccines, and other interventions, in terms of activities, it is requested to the countries to increase the investment in relevant R&D. So based in the Global Action Plan, Colombia is in process of perfectionating and updating the National Action Plan. The NAP was initiated in 2017 in Colombia. This is the technical board that is in charge of the design of the NAP in Colombia, with 5 ministries involved. The Ministry of Health, which is the leader, the Ministry of Agriculture, the Ministry of Environment, the Ministry of Sciences, and the Ministry of Education. And the ministries are using their different institutions to develop the NAP. For the case of agriculture, we have ICA, that is the Colombian USDA, and Agrosavia. For the Ministry of Health, we have INS, that is a National Health Institute, and INVIMA, that is like a FDA, American FDA, and we count with the participation of WHO and FAO. The One Health approach is still relatively embryonic, and there is low visibility for research in activities, for research activities in the NAP. When we look at the surveillance activities, we can see that there is progressive deployment of infrastructure and new technologies, which is in charge of different institutions, INS, ICA, INVIMA. The hospitals and the health service providers, are private and public, are progressively joining this effort regarding antimicrobial resistance surveillance, as well as the health management organizations, which are all private in Colombia. The Ministry of Health created the National Genomic Center this year, but we can say that the agri-food and environment sector are lagging behind the human sector in terms of surveillance. As far as research activities are concerned, there is not a national strategic research agenda yet established, and the network of teams involved in the research is relatively limited because we have less than 30 entities involved. That for the size of the country that is Colombia is a little bit short. At this time, Colombia still has limited participation in international consortiums. There are few niches of expertise that could be interesting for the research of antimicrobial resistance in Colombia, but we can say in general that the research activities are more based on an opportunistic approach with limited financing. Therefore, the research activities are more independent initiatives, not yet coordinated in a national plan. As an example, I show you an initiative that we took in Agrosavia. So Agrosavia is the Colombian largest agricultural research institution linked to the Ministry of Agriculture. It has approximately 700 researchers in 13 research centers and 9 offices. Agrosavia aims to provide new knowledge products, processes, and services for the Colombian agricultural sector. Among different areas of expertise, Agrosavia works in food safety and antimicrobial resistance under the One Health approach, and also evaluates its impact on public health. My journey began in Agrosavia in 2007 with the idea of establishing a pilot project for antimicrobial resistant integrated surveillance. This is our trajectory from 2007 or 6 to 2022. We have two emblematic milestones that profile our research. The first was establishing the first pilot of a program, of an integrated program, to monitor antimicrobial resistance. The name was COIPARS and is the first one in Latin America. For the pilot, the first thing we did was to map the landscape of institutions that work with antimicrobial resistance in the human and agricultural sectors. Regarding the national authorities, we have ICA, Colombian USDA, as I said before, from the Ministry of Agriculture, INS, that is the National Health Institute, and INVIMA, the Colombian FDA, from the Ministry of Health. Agrosavia is part of, at that time too, was part of our research entities, as well as several public and private universities located in the whole country. We conform a public-private consortium with the main actors, including official entities, universities, the Poultry Federation, and the biggest supermarket chain in the country that appears here as Grupo Éxito. The program was an adaptation of CIPARS, that is the integrated program of Canada, for Colombia in the poultry industry. We found interesting results related to multi-resistant strains of Salmonella, Campylobacter, E. coli, and Enterococcus. The resistance profiles showed particularities associated with the country. In addition to the example we gave of Salmonella, here we can see the results of antimicrobial resistance of Campylobacter with high percentage of resistance to fluoroquinolones, macrolides, and tetracyclines, which are the antibiotics used in clinical settings. The results were published in an international journal and socialized in Colombia, and I socialized it to you. We presented the process for creating the surveillance program in various Latin American countries, and in some cases, our experience was used as a starting point for the respective programs. This was the maximum that we could advance in Colombia, since unlike in Denmark or Canada, in Colombia, it was decided that the Ministry of Health would direct this integrated AMR surveillance program. It is currently being set up with our participation. We are in charge of genomic sequencing and bioinformatic analysis. But to get to this assignment, I must tell you about our second milestone, the confirmation of the genomic unit in Agrosavia. As a result of this first milestone, we achieved concrete results such as having contributed to the public policy with our research on colistin, with the circular that prohibits the use of colistin as a growth promoter in the animal industry. Our investigation was the basic for issuing alerts as the detection of Optra gene in poultry meat isolates for the first time in the Americas, which is related to linezolid resistance. As the request of the international organizations, we successfully organized the IGSR meeting, of which we were members in 2013 in Colombia, and the Pulsen meeting for the first time was organized from the agricultural sector in combination with the National Institute of Health. Now we arrive to the genomic unit. This trajectory and achievements gave us international recognition that allow us to be selected as the only representative from Latin America to be part of the Global Health Research Unit Consortium on genomic surveillance of pathogens, a project of £1.2 million funded by the National Institute of Health Research, UK, and coordinated by the Center of Genomic Pathogen Surveillance and the Sanger Institute. With this project, we obtained a specialized human resource, workflow implementation for WGS or whole genome sequencing, acquisition of equipment, computational capacity for bioinformatics analysis, and gold certification in good financial practices from the African Academy. We sequenced almost 4,000 bacteria and produced 10 publications, including 7 in high-impact journals in the clinical sector. One of the most important research or results was the work that we did in the genomic epidemiology or carbapenem-resistant Klebsiella pneumoniae in Colombia. This study was done by the Global Health Research Unit, UK, and Agrosavia in collaboration with the Colombian National Health Institute, INS, which is the institution in charge of Klebsiella pneumoniae surveillance in the country. The selected isolates came from the National Reference Laboratory Isolate Bank of the INS and were all carbapenem resistant. Carbapenemase genes were identified in 92% of the CRKP isolates. Among carbapenemases, KPC was identified in 76% of the isolates. These findings confirm that, unlike in other regions of the world, KPC continues to dominate in Colombia, and OXA48-like does not play a role in carbapenem resistance. They also indicate a recent expansion of NDM in Colombia. We are analyzing the results of several WHO AMR priority bacteria of the human sector, and we hope that the results would help to contain the AMR in the country. This is the style and validate capacity that we have. We have labs, equipment, robots, sequenciator, and servers. And our second phase or new stage begins in August 2022. It will be focused on strengthening research in One Health to collectively create a national agenda to optimize resources and prioritize projects to study mainly antimicrobial resistant emergence hotspots. So now we are going to talk about the agenda. So the next step, as I said, we have now is the elaboration of the One Health Strategic National AMR Research Agenda. The name of this initiative is ANICRAM, that stands for Colombian National Agenda of Investigation and Innovation in Antimicrobial Resistance based on the One Health approach. We have decided to take a bottom-up approach, working in collaboration with the community of researchers who are involved in AMR. We are using as a framework all the guidelines developed by the GAP, Global Action Plan, and also the Strategic Research Agenda of the Joint Program Initiative on AMR, which has been updated in 2021. We are also connected with the ongoing quadripartite initiative between WHO, FAO, OIE, and UNEP for the prioritization of the research topics in AMR, and our intention is to coordinate all sectors through a network-centric organization type hub and spoke in Colombia. So, to develop this national agenda, we have two flow of workshops, one which is based on research topics and the other one about the innovation topics. And we have pre-selected research teams. So in terms of innovation, we are asking ourselves how the Colombian teams can participate into the overall effort of finding new antimicrobials and targets. Also, we have several research teams working on alternatives for antimicrobials, and also there are teams that are developing new diagnostic tools, because like any low and middle income country, we have a desperate need to develop more point of care or rapid tests to fight against antimicrobial resistance. In terms of research topics, we are working more on issues of transmission. We have selected 3 topics. One is on revealing the complex dynamics of selection and transmission of antimicrobial resistance in a specific situation of Colombia, identifying factors responsible for the persistent and spread of resistant organisms and resistant elements in the specific condition of Colombia, and determine and model the contribution of contamination sources, environmental reservoir, and exposure routes of the emergence and spread of AMR and that means, or in other words, the research and investigations on hot spots. So the challenge that we have is really change the members of this community who are high specialists in a very specific areas on AMR into strategic contributors that have a look at the national issues of AMR. The second challenge is to foster a collaborative efforts between these groups who are used to compete for limited resources. And the third challenge is to find resources for these research activities. So I'm going to conclude with 4 concluding remarks. The first one is that in Colombia, like in other low and middle income countries, exists a specific risk for AMR development due to challenge on health systems, informality in agri-food markets, and lack of infrastructures. The second remark, in Colombia, like in others low and middle income countries, the One Health approach is high relevance since livestock production systems generate much greater contact between humans, animals, and the natural environment than in high income countries. The third one, that in Colombia, like in other low and middle income countries, genetic approaches for mapping transmission across the One Health continuum are indispensable tools that need to be developed in a coordinated way at national levels and in collaboration with international organizations. And the fourth and last one, that is in Colombia, like in other low and middle income countries, AMR development is a complex problem with characteristics of not linearity, emergence, positive and negative feedback and adaptation, which requires a customization of One Health research implementation, including more bottom-up approach and specific innovation routes. I would like to attract your attention on this paper, of which I contributed with my colleagues of Nigeria, where we have a review of specific problems of AMR in developing countries, and that has been published in Nature Microbiology last week. Thank you very much. This is the team of Colombia, where we have microbiologist, bacteriologist, nutritionist, and an expert in strategic development. Thank you very much.
Thank you very much, Pilar, for presenting. Yeah, you can stop sharing the screen now.
Okay.
Thank you very much, not only for your presentation that gives us such a good overview of what you have been doing and what's going on in Colombia, and the way forward that you are outlining. So now, and you kept the time, which is great because we have a lot of time for the discussion, as we wish this to make it a dialogue. So I would encourage all the participants to post your questions in the chat, and I'll do my best to read them. And if you don't have time to address them all during the webinar, then we can follow up by email. And I can start, Pilar, asking one thing. So you presented a lot of work on research, and all of us struggle when we speak with policymakers to bring research results like you are presenting here, translating them into policy. So what is your experience in Colombia? For example, is it how can we bring research results like this to the attention of policymakers and making them aware that policy changes most of the times are needed?
So the good thing is that we work hand by hand with policymakers. So all the time we are doing feedback with them, and now more because we are part of this technical board or technical table we call. So our research are always shared with them. For the case of MCR, of Colestin, we did the research with the National University, and then we share with the authorities of the country and the ministries, and among all of us, it was possible to write the circular and be approved by the ministries, different ministries. But yes, it's not easy because there are other interests around, and it's something that is not short. It takes a long time. It's not that it's going to be in a month or two. They have to go ministry by ministry, get the approval, and but it's always possible. And the thing is that our research should be rigorous to show the importance that in this case was what happened with Colestin to achieve this prohibition of the use of as a growth promoter in the animal food.
Thank you, Pilar. And so that bottom-up approach and the communication established seems to be a way to go in terms of making sure that the results that you find at the field reach the policymakers. You feel that that bottom-up approach made the difference?
Yes, but there are two differences here. When we talk about surveillance, that is very difficult to do in a bottom-up, and we will work about research. That is what we are doing now. So I'm going to tell you how we are doing that, because we are in the way we are doing that. We hope that at the end of this year, we have this agenda. So what we do was calling, do a convocatory of the people that are working in antimicrobial resistant research, human, animal, and also environment. That is only few people in Colombia. And all of us, we are doing the agenda. Of course, we are the ones that are leading this initiative, and we are meeting monthly, virtual, and also we are preparing some workshops. We are not yet, but it's going to be soon that we present this initiative to the table, to the technical board. And in that case, we can discuss what we decided to be our prioritization to work, because we think that in countries that we are not rich, we need to save the resources. We cannot repeat. If you begin to review, many people repeat the same researches, small, bigger. So in this case, what we want is that we can work in a common research under the One Health approach.
Okay, thank you very much, Pilar. We have a question from Alejandro Dorado Garcia, our colleague here at the FAO headquarters, regarding dissemination. And he's asking, in terms of the dissemination of the COIPAR's results, he's aware of scientific publications, but are there national reports publicly available of the results of the COIPARs?
Okay, so maybe I didn't explain myself well, so I'm going. So COIPARs was an initiative that we have from Agrosavia that was former Corpoica. So we did this first pilot of antimicrobial resistance surveillance. We published the results. We traveled through Latin America, showing our processes, how we began, how we interact with other stakeholders, etc. But as I said, we stopped there because we are not we are part of a Ministry of Agriculture, but we are not a regulator. And in this case, the Ministry of Health decided to be the one that is leading this initiative. So from them that it was finished around 2014, and now we didn't have reports. We are we are almost finishing the first surveillance in the country. And in that part, we are going to contribute with the genomic analysis and approach of that. Okay. I don't know if I was clear to my explanation, Jorge.
I think so. You also have already given us some idea, but now I think it was even more clear.
Okay.
So thank you for that, Pilar. Besides several compliments to your presentation, so congratulations on that, and thank you for doing it. We have questions from Alejandro and from Quastros regarding the integrated surveillance. So, for example, Alejandro is asking if there's any integration regarding the AMR surveillance and AMU data. And Quastros is asking regarding One Health AMR surveillance good experiences in Colombia. For example, the tricycle, the ESBL tricycle surveillance. If you could share with us, please, some of these experience that you have regarding the integration of surveillance, namely this AMU and AMR, and for example, the experience that you have with tricycle in Colombia.
Okay, so about the integrated surveillance, yes, we are at the point of giving the first results. It was that technical board that we have that is directed by the Ministry of Health, and we have those institutions, ICA, INVIMA, INS, all working together, and we are missing the last part because we are doing some aspects of confidentiality. When the official sectors are there, we need to be very legal about all the interactions. So we are at that point, and the results are going to launch very soon, I think before the end of this year. And the second question, sorry, was about
the tricycle. The tricycle.
Ah, the tricycle. Okay. We have been having a lot of exchange with George, with Jorge Mateos.
From WHO.
Jorge Mateos. And we want to develop the tricycle. We need to have approval maybe for the technical board, but because we have this second stage of this project with the UK, we have the financial resource and could be an excellent example of a One Health research. We have many in the countries, but in the country research, or we have in our group, and we work, for example, the last one that we did was including water, but was the first one using metagenomics for the first time, I think, in the agricultural sector, comparing the farms with and without use of antibiotics. And we are analyzing the results. And also, but we work since my thesis, my PhD thesis, COIPARs, all was always under One Health. Some publications are there. And I think, as Alejandro knows, maybe Ricardo Castellanos did also publications in Utrecht about the salmonella that was collected through the poultry chain. Also, we did with the National Institute research following a complete avian or poultry change from the genetic material to the consumer or to the stores. And we follow and analyze all the bacteria that we isolate and compare what we have from humans and the percentage of the rates of resistance, etc. Is what we could do because we didn't have solid money or fundings as we have now. So it was step by step constructing and never abandon the antimicrobial resistance research in the country.
That's very good, Pilar, and it's good to see examples of integrated surveillance in different countries, not the ones that are classically associating. So it's good to see, and as we all know, there's the new Codex guidelines of integrated surveillance. So it's good to see the work that you are doing in a country like Colombia. We have another question from a colleague in China, Asia Wang. That thanks you for your presentation and would like to you to please introduce how did you get the antimicrobial use data in Colombia? How the process of getting antimicrobial use data in Colombia?
Okay, for our research, for our pilot, we had to go to the Ministry of Commerce and use proxy data of the importation of antimicrobials in the country because we don't produce the generic material. So we use that and we try to associate what was not possible. But it's the ICA, that is the Colombian USDA, the one that is in charge of that, and they are doing all the collection of data. They report to the OIE annually. So they are the ones that have the data. We are not, we are connected to the ICA, but we are not with those powers in the country.
Okay. Okay, so thank you for that, Pilar, and clarifying how do you get the AMU data. Now we have a question from John Kariuki. Also, thank you for the presentation. Are there antimicrobial growth promoters in use in Colombia that are likely to contribute to AMR? So a question about growth promotion in Colombia.
Yes, we have chlortetracycline is the most common one. And yes, when we compare with our findings, we saw a very high antimicrobial, very high resistance to tetracycline in our isolates, being Salmonella, Campi, E. coli, or E. coli. So yes, with the GAP and the National Action Plan, the focus is that this use of growth promoters are going to be periodically or diminish periodically in the country.
Good to know. It's good progress, and it's always challenging to make those transitions. So Rhonda is thanking you for the presentation. A question from Francesca, thanking you for the experience and the achievements. Considering the specific situation in Colombia and the presence of more hotspots than in high-income countries, are there plans to introduce the element of early warning system component for the detection of new emerging resistance determinants? And if yes, any preliminary idea for the implementation? So about the early warning system components for detection of new emerging resistance determinants.
So not yet, we don't have that yet. We plan to do the research of hotspots. The first is that it's going to be our protagonistic research in the agenda, is what we want to do. And maybe we need support with you that have a lot more experience than us in that. The thing is, in this country with this biodiversity, we have a lot more elements that we have to include, And also with this emerging economy, we have more things to introduce. So we don't have that yet in the country, and we didn't have plans, but we can think in that after your question.
Okay, thank you. And that's the idea of this, to bring ideas together. Question from a colleague, difficult one, Balakrisnan Nair. A question about alternatives. What alternatives to antimicrobials you are looking for? Alternatives to antimicrobials, if you are working on that and looking for that.
Okay, so the closest that we have now in Colombia is bacteriophages or phages. We have a group that has been working for more than almost, I think, 12 years. It's a group that is in the University of Andes. They have now a small startup, is the name, company. And we have been working with them with salmonella, with good results. But up to this point, we haven't escalated that part. And they are still working, but they are focused more in the human part. Also, we have some, phytotherapy that are used for some people, and probiotics that are developed in the country, but are specific for the bovine industry, for calves. And this is something that we plan also to evaluate how we can see an interaction between the use of these probiotics and the development of antimicrobial resistance. This is something that we have to think. We have in this new phase or stage, 5 years. So I think we have time to put these initiatives in action and to prove also how useful are they for the antimicrobial resistance content.
Thank you very much for that explanation on the alternatives. Another question from a colleague from FAO. If there is a comparison data between the lab results and the common antibiotics that veterinarians prescribe, if there's a comparison data between the laboratory results and the prescriptions of veterinarians.
This is something that we don't have now. And I'm telling you, thank you for all the questions first that I didn't think. So what is the plan that we have now? We are going to enter in the world of pets. There are some research in the country, but pets are maybe the most formal, the most in the animal or agricultural sector are the most that use prescriptions. So we want to compare that. There are some results that are preliminary and with a sample size that is not high, but it's important. It's around 1,300 from the University of Antioquia. And with that, we could compare if the antimicrobial resistance that they expose are similar to the ones that are of the antibiotics that are prescribed. And yes, in this case, but this is something that we plan with this second stage to go deeper because we consider it's very important. And about the livestock, in some cases, because we have huge farms, and about what I talk about informality. So I talk about the difficulty to follow stewardship of antibiotics. So this is something that we want to study in different areas of the country to prove if there is like that. But I advance and tell you that regarding livestock, the percentage of isolates that show antimicrobial resistance in meat and milk are very low at this point.
And the prescriptions there, some countries are adopting now the electronic prescription of veterinarians, for example, is it on paper, is it handmade? Or what is the situation regarding the prescription?
The situation is that officially the drugstores of veterinary drugstores should sell with a prescription. the antimicrobials. But this is not compulsory unless, because sometimes you have or farms in a very far areas of Colombia, or huge farms that in some cases, or in a very far places of Colombia, that is impossible maybe to have a veterinarian to prescribe that. So in a way, you can access to antibiotics for animals in a free way, not pets, but the rest in a free way. So even there is a resolution is official, in some cases it's not compulsory the way. We need more teeth to control that in the country.
Okay, so now we have a question from Alejandro. What is your view in terms of using NGS technologies for monitoring AMR as part of national surveillance strategies? In your opinion, how far are we of finding harmonized approach? Is this technology especially relevant for low middle income countries, or can it increase the technology gap? So the use of new technologies for monitoring AMR as part of the national surveillance strategies. You mentioned some new technologies that you are developing. So the question from Alejandro is about that. What is your view of using new technologies to do monitoring of AMR as a national surveillance strategy? Okay, so I think it's very important and it's a key. But I understand the cost that they have, because we need specialized equipment, the people to be capacitated or to be strong in the part of sequenciation that is not easy, and also in bioinformatic analysis. We also have to keep these teams. So in our case, it's great because we had these funds from the National Institute of Health Research of the UK, and we have now in Colombia this possibility. We are opening the country to work. But I think it's key, because if you want to compare in a more precise way, the best way is to use new generation sequencing. So now it's expensive, but with the time, as it happened in high-income countries, it's going to be less and less expensive. And also, what we did with our studies that we plan to do is to find a way that a sample size that is could be not with lots of numbers of isolates, could give us a picture of what is happening. But of course, the difference between using the other technologies with WGS is abysmal, is different. And in one health that we need to compare human, animals, water, pets, etc., it will be great to show the importance of antimicrobial resistance, containment, and use of antimicrobials in our countries. Okay, thank you very much, Pilar. I hope I answer. I think you did very well. Thank you. The last question that we'll take it just quickly. The last question that we'll take from the participants, and then we'll wrap up, is about is there any assessment of AMR in wild animals, considering the vast biodiversity of Colombia? So AMR assessment in wild animals in Colombia. Not yet. And this is something that we have to begin. The first picture that I have a picture of the Amazon house. I was there last March, and you could see how people share with wild animals all the time. So this is something that we have to do. We have also lots of deforestation in the country. And you know that is a pressure for the wild animals to move to the urban sectors. So we have to begin with that. And it's something that we hope we can do in these 5 years. No, I'm sure we are going to begin with that in these next 5 years. Excellent. Thank you, Pilar. So thank you very much for waking up So waking up so early this morning.
So
I'm sure you
3:30.
we made
So
you
thank
wake.
you very much to all
Thank you.
of you to be here.
Yeah, I'm sure you drank some Colombian coffee this morning to be sure that we had here on time. So I'll just conclude showing, just quickly share my screen like this. And now like this. So just to conclude that the next webinar like this, they are always organized on the second Thursday of the month at this time, the 12:30 to 1:30 Central European time. It seems a time that works decently well for all the regions. And then the next webinar will be in a very different topic. It's about the clinical breakpoints and treatment guidelines and how we can optimize veterinary antibiotics use through this. And will be presented by Peter Dambok from the Innovart network. So a very different topic, and the dissemination will be done the same way, and the registration and so on. And keep in mind that the recording of the webinar today and the additional resources that Pilar was kind enough to share with us will be also posted in the usual channels. And if you have any additional suggestions that we should take as the FAO AMR working group for the organization of this webinar, please do send it to us via the antimicrobial resistance at FAO.org webinar. So thank you very much, Pilar. Thank you all for being on that side and that questions, and see you next time.